Welcome to another episode of Women's Health Unplugged. I am so grateful today to be able to be joined by Dr. Sharon Malone. Sharon, thank you so much for hopping on a call with us today and for being able to share your journey and your new book.
Well, thank you very much for having me. Any opportunity I get to talk about my new book, I'd take it. So thank you.
Yeah, I'm so happy that you sent me that advanced copy, and I've had a great time cruising through it. And I have so many questions for you, and there's so many things that I want you to share with our audience about choice in their women's healthcare, because really that was one of the major themes that I pulled out of your writing. But first, can you introduce yourself? I would love for you to share with our audience what your where you came from, where your background is, and then how you got to this place in your career where you're such an influential gynecologist.
You are kind, but I'm Sharon Malone, and I am from Mobile, Alabama. So just take that as a baseline for my perspective on a lot of what I write about and a lot of what I talk about over the years. I'm the youngest of 8 kids, so I have had the luxury of watching the health journeys of not only of my parents but also of my older siblings, and that has really informed how I practice, how I talk to patients, because it's a very different experience, being a Black woman growing up in the South, and through pretty much the Jim Crow South era. So that informs what type of doctor I am. I practiced OBGYN in Washington, D.C. for over 30 years. And just about the time of COVID, I made a career pivot. I was part of that great COVID resignation, and not for any particularly traumatic reasons. It's just that I had a time to sit still. I can't even tell you when was the last time I had 3 months off in a row to sit there and to really think about what I wanted to do. And that really started this pivot in my life where I left clinical practice and became the chief medical officer for Alloy Women's Health. And from that, I discovered advocacy for women. I do a lot of advocacy work for women in midlife research, and really educating women. And that's been sort of where how I got to where I am. It was a long, straight path. And then I took a slight turn and ended up here. And if you had asked me 5 years ago if I would have written a book about women's health, I would have said, absolutely not. But you know what? You got to always stay ready. And that's what I do.
I love that. I remember that you saying when I read about you that you're the youngest of 8 kids. I feel like that would have just given you such a different perspective on life in general. I think about like
Right.
how, how many role models you had in your life. How many siblings were older sisters?
I'm the last of 5 girls. So it's 3 boys and then 5 girls in a row. And I'm the last of 5 girls. And to give you some perspective, when I say I'm from a family of 8, it sounds like, oh my goodness, there must have been a scrum in your house. But I'm the last by a lot. So the next sibling in age to me is 7 years older than me. And my oldest brother is 23 years older than me. And to give you some even further perspective, which is why my take on things is a little bit unique, my dad was 21 years older than my mother. So that means my dad was born in the 1890s. My mother was born in the 1900s, in the, 1914, as a matter of fact. And my older brothers and sisters were born in the 30s, 40s, 50s. So I sort of had a bird's eye view of medicine and attitudes and behaviors over basically 100 years of just direct family history.
That's so insightful and amazing because when we talk about like choice, right, in medicine, it's one of the things I want to talk about. One of the themes that I pulled out from your book that I thought was so important is, medicine has changed so much in the last, well, obviously 100 years, but I would say even in the last like 5 to 10 years, there's been lots of shifts in the culture of women's health and women's medicine where really women have choices. And I'm curious around how you feel about those choices. I'm curious about how you feel about that theme and evolution in medicine, and then how that emerged as one of the major topics in your book.
Well, medicine has changed I would say tremendously. I started practicing in the 1980s. And what has happened? Well, there's good news and bad news. Some areas of choice have been expanded and some have been constricted. And we've got to deal with the fact that in some areas, particularly when it comes to women's reproductive choices, they are fewer now than they were 50 years ago. So there's that. But I think what's really changed in the attitude from women, we've sort of gone away from this notion of the doctor says, and you just do what the doctor says. We have an explosion of information out there, and I think that women are becoming more educated about what their options are. Perhaps not enough, but they are at least aware of the fact that there are other ways to do it. And our job as physicians is to sort of help them sort that information into something that's really, and I hate to say information, it's not information. We have more data. We're inundated with data, but it's not really useful information until it's put in context. And I think that that's what we as physicians, should strive to do, is to take all that disparate information, trash that people have out there and they get from the internet and Dr. Google, and to make it make sense to them. But here's the rub. We've got less and less time to do that. For in today's world, I think that, doctors are working at, like hamsters on a hamster wheel in terms of trying to get patients in and out. And that is not an environment that is particularly conducive to good conversations, discussing options, and helping patients away. So we're going to have to sort of adjust our behavior, and I say as women and as physicians, to accommodate this new change. And I think that there are fewer women now who are willing to go into a doctor's office and just say, I'm going to do it because the doctor said. Those days are kind of in the past.
Yeah, I agree with you. I think it's more of that consumer nature, right? Like people are, I'll use the word buying, like they're the buyer in healthcare
Right.
now more than they ever were before. I think about even in my grandmother's generation, like she just consumed healthcare, right? Like she just did what they said and if she had questions, she kept them to herself. Or if she had questions, she came home and then she just asked like her girlfriend about it.
It's
But
true.
she wasn't the buyer, right? She
Right.
wasn't weighing the options or looking at all of the options that were available. She just did the one that was offered to her. And there was that real hierarchy between patient and physician. And now we know that that idea of shared decision making is the best option, but there's an implication that things are happening when we're making shared decisions with patients and doctors. And I'm not always sure that we're meeting all of that criteria for us to be achieving that.
Right. I think doctors haven't really signed on to the shared decision-making piece of it. I think more patients are ready for that than doctors are ready for that because, and let's be clear, I am not, I have been practicing in this world and I know the real constraints of time. But when you are really trying to have a robust conversation, a shared decision-making type conversation, that requires time. It requires knowing to whom you are speaking. And again, in today's world, we are faced as patients, as we are interacting with people that we may have never met before. The notion that I could practice, like when I practiced, I stayed in one place for 30 years and saw, women through puberty and college and childbirth and perimenopause. That is not going to be the experience. So you are going to, and this is where I get back to you have more control than you think, because the only person that has that continuity of knowledge about you is you, not that physician, because you may see someone this week and someone else, 6 months from now as they have moved on. And that's where, when I wrote the book, I wanted to give women all the information, or at least as much of the information as I could, such that they understand that that shift has occurred. You are your own primary care. You are your own primary care person, not your doctor, because who knows who he or she may be next year, next week. So That's why I said these conversations are hard, they are nuanced, and it requires some information that sometimes that physician in front of you may not have. So if you're, whatever you're talking about, if someone gives you one option, be prepared to have the questions to ask. You may not know the answer, but if you ask the right questions, you can get to the answer that you at least will be part of that shared decision making, not just do this because I've got to go in 2 minutes.
Yeah, you said that right before we hit record, and I want to just call it out one more time. You said, if because I had mentioned, one of my favorite parts of the book was when you talked about this solution for fibroids. And for me,
Right.
it was around the fact that, you called out one particular patient that you had worked with. And although there were 4 or 5 different potential options, right? Could she get an IUD? Could she keep, getting more medication to try and control the bleeding? Could she have a hysterectomy? Could she have a myomectomy? And yet, like the answer is not crystal clear, like it's not clear cut. And the decision you made had more to do with the travel in her job than it did with anything else. Because when we looked at her as a woman, that was the greatest impact of her heavy bleeding was on her job and her ability to show up in her work. And you said before we hit record, if your doctor only offers you one option, you haven't heard them all, right? Because
Right.
there's never only one choice.
You know what? One of the things that I do a lot in my book is that I bring my mother into it. And I lost my mother when I was 12 years old. But there's a common element that sort of is interwoven in my book, and it is really about common sense. Now, my mother, wasn't, a highly educated woman, but she had more common sense than probably 10 people put together. And you had to, because given how she grew up and where she grew up and raising 8 kids, she had to have a lot of common sense and know how to triage. And, so I have a lot of sayings, Southernisms that my mom came up with. And I thought about it the other day and I said, you know what my mom would say to that? My mom would say, well, you know what? There's more than one way to skin a cat. And I thought about that. I was like, why do you need more than one way to skin a cat? I mean, who's skinning cats? But anyway, I digress. That would be something my mom would say. And that whole notion about 4 or 5 options, and we've got more options now than we've ever had. 40 years ago, it would be one. Oh, you're bleeding? Have a hysterectomy. That was the solution to every woman's problem. Have a hysterectomy. Well, now, thank goodness, we have lots. We can treat medically, we can treat with minimally invasive surgery, but ultimately, sometimes a hysterectomy is the right decision, sometimes it's not. And that's why I said it, to have at least the idea of what your options are and what your treatment goals are, because everyone's, different. And it's never going to be one size fits all, even when you're choosing medications. And so, again, be forearmed, and warned about what the situation is. And the more you bring to that conversation, and the thing I also talk about is learn to be a good storyteller, because the more efficiently you can convey whatever your problems are, what you want to do about it, and what your concerns are, the better outcome you're going to get on the other side.
What do you think, Sharon, about, when we talk about that shared decision making, like in theory, you should be
Mhm.
getting all the options that are available, some of the pros and cons, some dialogue with your doctor. But sometimes the way that that gets shared, it can leave women feeling like they're the ones that are supposed to be solely responsible for the decision. And they're like, I don't know, Jordan, if I should have my fibroid removed or a hysterectomy. Like the way it got presented to me was like, you decide.
Right.
And that feels almost like unfair pressure for that
It,
person. Those women are like, I didn't go to medical school. Like, I don't know what I should do. But
that
that's not really how what shared decision making looks like. But how do you coach women through that feeling of feeling like now they're the ones that need to make the decision?
Let me say, it is perfectly valid. I mean, and you're absolutely right. I went to medical school, you didn't. I can give you what your options are, and I can tell you the pros and cons of each. I will even tell you which one I think is the best or better option. That's on the table. It's not, that's really unfair to say someone like, well, there are 4 things, pick one. You know, the conversation really ought to be more of, what, again, knowing what your treatment goals are. What do you have to do? Maybe now is not a good time for surgery. Maybe you want to have a baby. All of these things have to be factored in. But can you ask for my opinion? Am I allowed to give you my opinion? Absolutely. That's what you pay us for. We did go to med school and we know a little bit about some things. We may not know as much about you, but we do know at least what the pros and cons are. But again, we get back to the basic conundrum. How do you have that kind of conversation in limited amount of time? And this is where I think that we in the medical profession have got to stop delivering care in 2024 like it was 1924. And I know it's not possible to have a robust conversation about anything, particularly as important as your health, in 15 minutes or less. Because you have a 15-minute slot, but you don't get to talk to doctor for 15 minutes. You talk to doctor for about 5 to 7 minutes, perhaps. So this is where I think that we in medicine have sort of failed patients, because all of that conversation, that vetted, really good information should be available to you, but from a source. You shouldn't be running out to the internet either, because you don't know. People are talking about everything. Does that make sense? I don't know. Someone tells you this, someone tells you something else that's completely the opposite. But I think that we in medicine have to figure out a way to convey information, use technology. My goodness, we have it for everything else, to get that kind of conversation going, and at least the information level setting for patients before we get to that conversation. So now if you've got 5 or 7 minutes to talk, we can run through the options, because I'm not starting from the letter A on each of 5 options. That. So you're prepared, I'm prepared, and we can just get down to the business. But no, that's if someone just does a data dump on you and says, I don't know, you pick. No, that's not good either.
Yeah, I feel like your ideas are so practical. And I think that's how you presented your information in your book. You're like, this is like the practical woman's guide to the majority of women's health concerns in midlife. What was your favorite part to write about, and the part that you felt like was like the biggest expose, I guess, on like times where you've seen a disconnect between what maybe should be done in women's health versus what actually gets done out in the wild?
You know what? I spend a fair amount of time, and I've spent a fair amount of my practice in women in midlife, so perimenopause, menopause. And I think that has gotten a complete short shrift prior to, say, 5 years ago. The conversations around it, normalizing it, making women understand that this is a normal transition in life. It can be easy, it can be hard, but however it goes, there's something that we can do about it, and there are things you need to know. So that is where, like I said, when I thought about writing this book, and initially, everyone said, well, why don't you write a menopause book? I'm like, no, because there's a lot more that's going on in your life. That's like, we spend so much of the conversation around women's health, and it's around prenatal care and maternity and whatever. When you spend a very small sliver of your life being pregnant, you spend the rest of it being a woman, before you're pregnant and after you're pregnant. And, every woman remembers that book, What to Expect When You're Expecting. And, we bought it, and I would read it, even though I kind of knew what to expect. I wanted to know what my patients were reading and whether or not I thought that was a good source. Well, and it was a really good sort of reference book. And when I wrote this book, I thought about it and I said, well, what about if I wrote it from the perspective of what to expect when you expect to live beyond 40? What are the things you need to think about and prepare for? And yes, perimenopause and menopause, that's a big portion of it, but there's everything else. There's heart disease, there's high blood pressure, there's weight, there's cancer, there's Alzheimer's disease. And I give you enough of all of those things such that you are aware of what could possibly, and not will, but what could possibly be looming in your future, if not for you, for your parents. And how are you going to be a good care getter for yourself and even a caregiver? And you have to at least consider these things. So that's why I took that approach. It's like, yeah, we're going to talk about perimenopause and menopause, but what about the rest of our lives? And I think that that's where we as women have not really had the talk. We talk about what happens at puberty and what happens in pregnancy, but what about all the rest of it? That's really what I was trying to get across.
Yeah, and it does such a great job of that. I'm so hopeful that, when we look at the research on women being able to identify their own health risks, they can't, or at least the data we had, like, maybe a couple of years ago, they couldn't. We would ask women, like, what's their greatest health risk? And they would
Right,
maybe point to breast cancer or point to just cancer in general.
right.
But, failing to acknowledge the importance of heart disease or
Yeah,
osteoporosis or some of
yeah.
those other big players as far as like overall health risk. And, one of the things you do well is like calling out each of those areas, like you just said, where it's like, here's the snippet of all the possibilities. And it gives them like that airtime to each of those conditions so that when people do go into their health appointments, they are, more knowledgeable or at least have enough baseline knowledge that they can start the conversation with their doctor, like you said, not from like square one.
Right. And let me say this, because it's not gloom and doom, people. It is, I say these things because there is so much that you can do starting in not in midlife, but you can start in your 20s and 30s. And that's why I said this book is called Grown Woman Talk. It's for any person who considers themselves a grown woman, because actually the earlier you start thinking about these things, the more of an impact you can have in terms of avoiding them. And that's the point. I want you to understand that, just because you have a family history of high blood pressure and diabetes, that is your fate. It doesn't have to be. If you keep doing things the way that you do it, because we share a lot more in families other than genes, then yeah, that may be your fate. But I want to take away that inevitability belief that people have about disease and what they think about aging. And I think I really want women to understand that yes, you can age healthily. Not necessarily, nobody's trying to be 20 again. No, I didn't say that. We're going to age. Of course, if we're lucky, we will, but let's be good at 60. Let's be good at 70. And so that's the kind of practical advice that I put in there, because I think that the more you know ahead of time, the better you're able to navigate and sort of avoid some of the pitfalls that may be coming down the road.
Yeah, it's funny, like a well-educated woman on any topic, right? You can never see a more motivated person to do something than a woman who knows something, right? And it's like
Exactly.
that's been the missing gap like over the decades in healthcare, is that the knowledge has been kept, behind the iron gates of your doctor's office. And I love that you've taken that approach of like, actually, we're just gonna open that up and give you this information before you step inside my office. Um, and hopefully it's going to battle the misinformation, because what happened is like we were still keeping all of that health information like close to our chest as the whole profession of medicine, and then the internet happened, and so what women had access to wasn't necessarily accurate, but
Right.
they're desperate for health information.
Right.
How, aside from reading amazing books like yours, how should women navigate online information, or what level of skepticism do you want them to take while they're scrolling their social media?
Well, and that's also one of the things I put in the book. I shared some resources. Someone's got to vet it for you, because as I said, you're right. You didn't go to med school, and everybody sounds really credible. They're online and they're, have on a white coat and they're saying stuff, and it's like, well, that sounds right. Um, and sometimes that requires a little bit of due diligence on your part, of knowing the people to follow, because there is a lot of good information out there mixed in with all the nonsense. And, so that's why I did include some resources at the end of my book. So you can say, well, here's a website to go to. Here's a person, if you're going to follow someone on TikTok or on Instagram, follow someone at least that's giving you some scientifically based recommendations, or opposed to. And I also say, be careful about people that are, I said, if someone's selling you something and it sounds too good to be true, it's either not that good or it's not true. So, and your job is to be a little bit discerning before you spend your healthcare dollars, because I think when it comes to menopause, and here's the good news. There's some good news about menopause and perimenopause is that there's never been more awareness because women are talking. And I have to say, I will give credit to this next generation of physicians who've come behind us, who have been out there and they are screaming it from the rooftops and saying, what the heck? Why didn't we weren't taught this. We want women to know, why were we keeping this information to ourselves? And so it's raised a level of awareness for women. And I say yay for that. But again, you just have to be careful and know who those people are and know what the motivations are behind what it is that they are selling. And just be, it's not impossible, but it does require a little homework.
And common sense. We just have to be more like your
Common
mom.
sense.
Yeah.
Exactly.
Sharon, if you were going to write one more chapter for your book, what would you have written about?
Oh, let me see. If I were going to write one more chapter of my book. That's a very interesting question because I think I covered everything. No.
I think you did too. But I'm always
No, you
curious,
know
right?
what?
Like once the
No,
baby's done,
no,
sometimes we
right,
have these like, or it comes from a different place, right?
right.
Maybe a more like
Right.
grounded, like now that I've said all this, this is what I
Right.
want to
You
say.
know
And that's what I'm
what
curious about.
I know exactly what I would have written about. I would have written a chapter more specifically on mental health, you know, because that is a huge component of what happens, as we age. There's more depression, more anxiety, a lot of issues that really need specific attention. And I did know that if I started down that road, there could be, another 15 things I could have written about in mental health. But I will say we'll save that one maybe for the next volume.
And
But
say it too.
that's the only thing that I did not go into in any particular depth. We kind of touched on it, but not so much.
Well, I really appreciated having the opportunity to read through your book. I was so happy to see the call outs on heavy bleeding and endometriosis and some of these pieces that I feel like I've worked so hard to create information conduit to women so that they have better access to information. Exactly like you and I have the same value of like, we need better educated women sitting in doctors' offices so that they can advocate for themselves, so they have the language to speak for themselves. I love the quote. Michelle Obama writes you a beautiful recommendation on your book on how knowledgeable and practical it is. Can you let our listeners know how they can get it and how they can be connected with you?
Absolutely. You can follow me on Instagram. You can also go to my website, drsharonmalone.com, and I promise to create more content. I'm a little bit old school, so I'm like, oh my God, do I have to say something every day? So I'll do better as time goes on. But my book is available. You can get it anywhere. You can get your books from Amazon, Barnes and Noble, Target, Walmart, your local bookstore, which is always a good place to pick up books. But, I want to be out there, and what I really want to be is a trusted source, because I want women to understand that this book was motivated not because I don't need a vanity project. I don't need, I'm not trying to be famous. I just think that when you've got this much experience, you learn some things along the way, and you learn a lot of things that you didn't pick up in a textbook. And I realized, talking to my friend group, and I'm the only doctor in my friend group, I'm the only doctor in my family. And the other thing that was glaringly obvious to me, that, I'm interacting with very smart, very well-connected people who have access. And again, the things that they don't know could fill my book. And I said, now, if you don't know that, then where's the gap here? It's certainly not in their ability to understand. It's just that no one's bothered to give them the information that they needed. And so that was really sort of where the book came from. It's sort of like I've answered a lot of questions, and I said, wait a minute. I would come in sometimes, someone would say something. I said, did your doctor not tell you that? And they're like, no, I never heard that before. I was like, oh my God, we got some work to do. But a lot of it has to do with just the haste and the time factor that doctors have to really go over things, and lack of really context and not knowing their patients and knowing what might be important to them.
I love it. So the book is called Grown Woman Talk, and we'll put the links to purchase it in the show notes for today's episode. Thank you so much, Sharon. I love hearing people's journey and stories, their why, for why they're, creating something, and what they saw that was missing in their day-to-day work that inspired them to create a solution. I think that's so inspiring for our listeners to listen to, not just the content of your book, but also the using your past to propel you into creating a solution for people in the future. I think that's so cool. So thank you so much for spending time with us today. One more final word for our listeners. Do you have anything else to share?
Yes, I do. I would say this, we talked about a lot of heavy topics that are in my book, but let me say this. I tried to do something that I hope I was successful at, to make it fun, to make it readable. I tell stories, I even have a playlist, at the end of each chapter. So as you read along, you'll see a little musical note and wonder what that's about. It's because, when you're trying to give people medicine, and some of it's tough medicine, you've got to inject some humanity into that story. And that's what I hope I was able to do, and to make it not be something that you would dread reading, but something that you would enjoy reading.
Amazing. Thank you so much for being here with us today.